Hi, today we have Dr. Teresa Sievers here with us, and we have a question. We had a question actually came in here last week, and it is about gouty arthritis. We know we have a lot of forms of arthritis, but those of you out there that have probably typed in gouty arthritis want to know a little bit more about it. We're going to talk about the causes of gouty arthritis and how it happens and what it is also.
Yep. Gout is a form of arthritis that usually comes on very suddenly. You actually know it's gout when the patient comes in with one joint that's exquisitely red, swollen, and tender, usually the toe, sometimes the thumb. And I say to them, how was your joint yesterday? My joint was fine. How was it when I went to bed? It was fine. I woke up at 7 o'clock in the morning, my joint was killing me. It was red and swollen. And they think that the first thing they say is, but I didn't hurt myself. And I said, well, it's probably gout. And the reason is the uric acid, it's often a genetic component where the patient is either making too much uric acid or not able to get rid of their uric acid, and the uric acid deposits in the joint, and then it triggers inflammation, and we get the whole immune system going, and the patient has severe pain. I mean, people will tell you they can't even tolerate the sheet over their foot if they have gout.
I heard about that.
It's very, very painful. And so they want relief immediately. And the typical, standard of care treatment is to give them steroids or colchicine. Colchicine has a lot of GI side effects. And we tell people to take that medication until they get diarrhea. That's how they know they're getting enough of it. So not too many people look at me like, I'm like, well, that's what we were told. Until we find other products that can work just as well, and I like to try something that's natural and might relieve their symptoms. And Flexcin I found to be very helpful. The reason is, unlike other arthritic components or supplements that are out there, it has cetyl myristoyl in it, which is a fatty acid that actually calms down the immune system. And if you can calm that down, the inflammation goes away, the uric acid deposits lessen, and the patient feels better. In the beginning, they're going to need a big dose. They're going to need 2 tablets 3 times a day. They'll usually do that for 2 weeks, and then they'll cut down to 2 twice a day. They usually will have pain relief pretty soon because as quickly as it comes on, it can often abate if you're treating it the right way, or whether it's medications or supplements, you will notice big improvement. Then they may need it for another couple weeks to help the residual. Sometimes if they change their diet and lifestyle, they won't need to stay on it, or people who've had a lot of gouty attacks and have chronically high gout, they may need it chronically because that uric acid can go on to cause more problems. It can even cause kidney problems. So you want to get that inflammation under control. So
would you say, like, specifically with gouty arthritis, stay consistent with it because you never know when that attack is going to happen?
You never know when exactly.
You don't want to take it that same day because that's not going to do anything.
It's not ideal. I mean, what you're going to want to do is be on something like a maintenance type
of dosage here.
Yep.
And I noticed I see a lot of colors here. I see yellow, but I see what sticks out to me is red, white, and blue. I'm assuming
it's made in the USA, folks, and that's part of the reason I'm glad to endorse it. People often pick up products and they see it's made in other countries, not to attack China as a whole. But we have had some things in the news.
We've had problems.
Formulas coming over, dog food's coming over. There's problems, and people don't want to be ingesting something.
Yeah.
And let's support our country.
And it's made here. The raw materials are sourced here. Everything's here in the United States. It's safe. We know it's it's regulated in those facilities. So
that's right.
Okay. Well, thanks, Dr. Sievers.
Great.
Appreciate it. Love the medical expertise. And if you guys want to do any more research, you can go ahead and Google. You can Google Flexcin, Google cetyl myristoyl, gouty arthritis. It's all available for you there on the internet. Okay.
Good.
Thank you.
Thanks.